Welcome back, everyone. Dr. Darlene Weyer is with us. She's a diagnostic radiologist, also the director of the Women's Health Center at Lima Memorial. Talking a little bit about 3D mammography, which obviously you've worked intimately with, and it's really become kind of the gold standard for detecting and diagnosing breast cancer, isn't it?
It has, yes. 3D mammography is the gold standard for detecting breast cancer. And basically the way 3D mammography works is similar to like a picture. 3D pictures give us more information than a 2D picture. It gives us more detail. And that's the same way that mammography works. The way a 3D mammogram works is that the X-ray machine takes an arc over the breast. It takes pictures of the breast in multiple different angles. And then it takes that information, synthesizes it, and breaks it up into 1 millimeter thick slices. So as a radiologist, in the past, what we would look at would be 2 views per breast. And now we're looking at anywhere from 150 to 200 images per breast. So as that information right there would tell you is that we're able to get a lot more information looking at each individual breast.
Who do you think it's designed for? And I know sometimes the national guidelines change, but what age are we thinking about when you should start getting checked out?
Age 40. Everyone at the age of 40 should have a mammogram every single year. And if they have a strong family history, we start 10 years earlier than a first-degree relative being diagnosed. So if you have a first-degree relative that was diagnosed at the age of 38, you should start at 28. But otherwise, everyone at the age of 40 should have a mammogram every single year.
Okay, good advice. You know, the other thing is you guys had provided some stats that are really frightening when it comes to rural, women to folks who live in an urban setting, and I guess the difference in the fatality rates and also those who are getting checked. And you were talking about the technology. That technology can kind of even that playing field, I think.
It can definitely even the playing field. And 1 in 8 women will be diagnosed with breast cancer in her lifetime. And in rural areas, rural America, women have less access to a 3D mammogram, and these women are less likely to come in and have their mammograms than patients who live in urban areas. And what the stats have shown is that when women in a rural area is diagnosed with breast cancer, she's usually diagnosed, about 19% of those women are diagnosed at a later stage of breast cancer. And when it's at a later stage, it's much more difficult to treat, and her prognosis is much worse.
I know, it seems like the community has been very supportive trying to get this technology because they know it's life-saving, and there is an effort underway to get community support in continuing technology. If folks want to get involved in that, what's the best way to do it?
That is correct. This is a life-saving technology, and Lima Memorial Health System is committed to putting a 3D mammography unit into one of our rural areas within the next year, because they see how important it is at saving people's lives, and they want to be able to save more lives. And if we're even able to save one more life by putting our 3D mammography unit in a rural area, that's what they're committed to do.
Okay, and speaking of saving lives, if folks are listening and they want to get a mammography or get set up for one, what's the easiest way to do that?
The easiest way to do it is, if you want a mammogram, is you can call our center right now at 419-998-4497, and you can schedule a mammogram. If you've not had one in the last year and you're 40 years or older, you should call to schedule one. And if you want to get involved with our fundraising event, we do this fundraising event once a year. It's called The Journey, and every year our hospital commits at buying new equipment for our hospital to benefit our patients in our community. And this year they've made the commitment to buy a new 3D mammography unit. If you want to get involved, you can participate in our live auction that we're going to have. You can go online and you can register, and you can start looking at the options. There are silent auction items you can bid on, or if you'd like to make a monetary donation, you can also do that.
Okay, saying like you said, a journeylikenoother.org, and check that out. Thank you so much. Appreciate it, Dr. Weyer.
Thank you, Jeff.
Nice talking with you. We'll be back.